So young cancer patients like you are rightfully confident nowadays that they're likely to be cured. It's amazing, really. But what scares them isn't the cancer so much, I found, is the possibility of being sterile, the likelihood of being sterile. Was that your situation?
That was the first thing I asked after, when I was first diagnosed in the doctor's office, and they took me straight to the ICU at the hospital. Once the doctor came in and laid out the plans and told me the diagnosis, of specifically what type of leukemia it was, and then, like I said, came in and with the plan of what we were going to do to tackle it, my first question was, am I going to be able to have kids?
Yeah.
And that was really, because at that point I was 23, and I knew I wanted to have kids. I knew, I had my future lined out at that point. I knew I wanted to be a teacher. I knew I wanted to have kids. That was my whole goal. So that was forefront, because I had already decided I was going to make it. I was going to pull through.
I remember you were the front page of the St. Louis Post-Dispatch, which was a very highly circulated paper at that time. In those days, in the newspaper era, and it was quite a story. It was shocking that young American St. Louis woman has her ovary tissue frozen. So this is really kind of a thrilling moment. Have you talked to your oncologist, Dr. Pincus, about all this?
He hasn't seen her yet. We haven't really taken her out just because with flu and RSV right now. But
this is her first trip to the outside, huh?
Pretty much. Pretty
good.
much. So the little limited amount that she will go out, like maybe to grandma and grandpa's, but it's very limited going out. They've told us we just have to be really careful with the flu being so high like it is.
Yeah, and luckily I got over it finally. I'm okay now, but you got to be cautious.
Well, and I had got in touch with it as well when she was in the NICU.
So did you have it?
Yeah,
oh my God.
New Year's Eve. That was awful.
That flu this year is a killer.
So, but we just take the best precautions possible right now with her. So, and with us teaching before we come in, clothes are left outside in the garage to make sure no germs come in.
Yeah. Oh, well, then we're honored that you came in to let us see her.
Thanks for.
But nobody here right now is infected, so okay. Well, I think your story is going to be very inspiring, because two things. One is when young women find out they have cancer, whether it's Hodgkin's, leukemia, lymphoma, or whatever, they all are worried about what you're worried about. And to see that you went through it and you have your family, even 20 years later, is going to be very inspiring and will really help these young women emotionally, because that's what they seem to care about most. Also, it may help that oncologists, unlike Dr. Pincus, usually they don't give a darn about your fertility. They want to cure you, and they don't want anything to get in the way of that. They don't understand a woman's feelings, that a woman wants to carry a baby. And so actually how did you get referred to us? Most don't get referred because the oncologist doesn't want to waste his time with it.
It was through Kathy Kleber. Actually, it was Dr. Jarrell, and who was with Dr. DeRosa, and Kathy Kleber, who was my bone marrow coordinator with Dr. Pincus.
See, the nurse is usually the one that will say something, but the oncologists don't. So hopefully some oncologists will see this, and we'll get the message out, because there's so many women that are being sterilized by their cancer treatment and are very, very sad about it. It's a tiny number of women who were cancer survivors who were referred for freezing their ovarian tissue so they could preserve their fertility. It's a very, very small number, and that's a tragedy. So you'll be an inspiration.
Well, and hopefully too, because a lot of times for female patients, that might be their driving force to try to help them get through treatment too, is that
Yeah.
idea.
Yeah, in other words, they can tolerate going through misery because they know
Right,
they have their ovary frozen, and they can really look for the future. They know we're planning on the future.
right.
We know we're
Right.
planning on them surviving.
And that's a huge driving force too.
Yeah.
So,
That's an important message.